I'm Dr. Shaheena Athif, consultant pediatrician working in Dr. Arbani Memorial Hospital near Electronic City. Chronic respiratory infections can be due to multiple reasons. Mainly it is due to an hyperactive airways. Like some of the babies, they will be having more allergic to dust, or maybe even any viral infections, that is any running nose can precipitate the respiratory infections in the form of running nose, cough, which may be dry cough more in the night. So in any of this case, it's a chronic treatment which has to be done. More than the oral medications, it is the measures which has to be taken care of at home, which is more important. If this is considering a 7-month-old baby, means the baby should be mainly on breastfeed. Try to avoid as much as possible the formula milk, which is usually bottle fed. This leads to increase in respiratory infections in children. And then again, if there is any mild running nose, cold, we have to use a normal saline drops into the nose, and following which the baby needs to be given steam inhalation. Another thing is the head end elevation. When the baby is sleeping, you keep the baby's head at a higher end. And the other causes, that is the allergens. So maximal reduce in the exposure to allergens, that is in the form of dust. So the child has to be avoided from the excessive dust. And again, if there is any heavy curtains, rugs in the home, that has to be frequently washed. The bed sheets the child sleeps in should be frequently changed. And always better to put a extra pillow cover so that the dust mites which will be present is reduced to the maximal extent. And if the baby has a lot of stuffed toys, this also leads to fine dust deposition in the stuffed hairs. So this has to be avoided. Okay. So mainly that is the main reasons. That is to reduce the hyperactive airway disease. Now another reason for chronic respiratory infection is if the baby has a gastroesophageal reflux. That is, the baby has excessive burping and small amount of vomiting after each feed. So this can be again avoided by the head end elevation, and if once the baby is started on solid feeds, this will reduce. So this overall helps in the reduction in the chronic respiratory infections.